Hi everyone! Eto, magbibigay na naman ako sa inyo ng update and tips para dito sa ating journey sa mga kasabayan ko na nagtra-transition and doon sa mga um, bago pa when it comes to transitioning. This video is for you. And also, welcome din dito yung mga fully bloom na. If you want to refresh your knowledge when it comes to hormonal replacement therapy and your transition, what are those considerations? So, yun ang topic natin. Okay? Ang topic natin is what is your considerations na kailangan mong gawin before having your HRT or hormonal replacement therapy. Okay, but before that, I want to discuss first the two types that I know na uri ng transgender. Okay? Yes, may mga types tayo. So, we have medical transition transgender. Okay? When it comes to medical transition transgender, is yun yung mga tao or mga transgender na nag-underwent ng hormonal replacement therapy. So meaning to say, they are changing their physical aspect and also their physiological aspect. Meaning to say, if you are born male and during the time of your puberty, ang iyong male hormone is testosterone. Your target is to lower the testosterone and increase the female hormone, which is the estrogen. So that is physiological change. Physical changes, it can be with the help of your hormonal replacement therapy. Mas nagiging feminized yung face natin because of the fat distribution sa face natin. So hindi gantong ka-feminine yung ating mga mukha before taking hormones. May mga rough edges tayo na prominent sa lalaki and mas nasosoft yan through hormonal replacement therapy, like your hips, the development of the breast. Iisa-isahin natin yan sa mga susunod na video, okay? And also, if you are considering surgery, okay, surgical implementation like aesthetic surgery. Like for me, I have underwent a non-surgical rhinoplasty and will be considering a permanent rhinoplasty. I have also a maintenance of my fillers and my Botox just to soften my facial features. Okay? So, iisa-isahin ko rin yan sa susunod na mga videos. And also, breast augmentation, surgical procedure para magkaroon ka ng full-grown breast. And also, the SRS. SRS is the sexual reassignment surgery. So that is medical transition transgender. Okay? Another thing is, sorry kung naka-uniform ako ha, galing kasi ako sa hospital. Second thing is the social transitioned transgender. Okay? When it comes to social, okay, kailangan ba na may babaguhin siya physically? Meron siyang babaguhin physiologically. If a person feels that, if a male feels like he is a woman, he's a woman. Social transition yan. For example, kung sa hindi siya nag-hormone replacement therapy, but in a community, nag-act siya as female kahit biological male siya, ang tawag doon, social transitioning. Meaning to say, pwede nating tawaging transgender ang isang tao kahit wala pa siyang pinapagawa sa sarili niya or walang medical intervention. Ang tawag sa kanila is social transitioned transgender. Okay? So, this video, we will be focusing on medical transitioning. Okay? Meaning to say, the first step na dapat natin gawin is to change our hormones because ang pinakamataas sa atin or prominent hormone as a male is testosterone. Ang target natin again is to decrease the testosterone and increase the estrogen para magkaroon tayo ng secondary characteristic of a female. Meaning to say, para tayo magdadaan sa puberty. Ibig sabihin, kung ang from male to female, parang ang lalaki, biological male, is magdadaan sa pubertal stage ng pagkababae. Breast growth, widening of the hips, softening of the features, good skin, yan. So, medical transition yan. And, kailangan, first of all, anong kailangan natin gawin? Magkaroon tayo ng decision. Okay? Decision because in this phase of our life as a transgender, this is a lifetime decision. If you're going to have a medical transitioning kasi mababago yan. And also, it can have a permanent effect on our physical and physiological aspect. Permanent. And also, not only permanent, but also irreversible effect. Irreversible, ibig sabihin, hindi na natin maiibalik. One of the example is SRS. Okay? Hindi na natin mababalik kung nagpakapon na ang biological male para maging transgender woman or woman itself. Okay? So, number one consideration, okay? Physical and physiological consideration. Una, tanungin mong sarili mo, bago ka magdesisyon, do I have a healthy body? Do I have an underlying disease or comorbidity? Meaning to say no comorbidity, may sakit ba ako? Okay, morbid, sickness. If you have, ito ilan lang to pero marami tayong dapat i-consider na sakit. If you have liver disease, kidney disease, hypertension, diabetes mellitus or diabetes, heart diseases, okay? You need to consider it because it can aggravate the condition if you're going to take hormones. Yes. For example, a concrete example is if you are taking Androcur. Androcur is a brand name sa company ng Bayer, okay? Androcur, we have 25 milligram, we have 50 milligram, we have 100 milligram, okay? Actually, Androcur, gamot yan sa may mga prostate cancer, okay? It is not intended talaga, technically, okay, na sinasuggest ng mga endocrinologists na para sa transitioning because there is a big effect, okay, on our liver. Pag long-term na ang paggamit natin yan. Okay? Androcur is a hepatotoxic medicine. What do you mean by that? Hepatotoxic, meaning to say hepa, meaning to say liver. Toxic siya sa liver natin. Okay? So, sa European country, at sa Amerika, hindi nila kinoconsider ang cyproterone acetate or Androcur for the hormonal replacement therapy from male to female. They usually rely on spironolactone or the brand name is aldactone or Hyles. Okay? I-discuss natin yung mga gamot na yan sa future. You comment down below kung ano yung mga ginagamit ninyo na mga hormones para makapag-research tayo and ma-share ko rin yung knowledge ko about those medication. So, sabi ko nga, lifetime yan. Okay? Estrogen. There are different kinds of estrogen. We have synthetic estrogen and we have bioidentical estrogen. The good ones na pwede sa transitioning is the bioidentical. But, again, there are some considerations. Kapag bibili kayo, for example, ng Estrofem, basahin niyo po yung mga leaflet and tingnan niyo yung mga contraindication and also the side effects kapag sa long run ng paggamit. Okay? Mostly, when it comes to estrogen, because it is a kind of fat, okay? Estradiol is a form of cholesterol. And kapag syempre nag-i-intake tayo ng fat, pwede mag-increase ang ating cholesterol level. And those cholesterol level can plaque or block our blood vessel. And it can be, it can aggravate the circulation, impede the circulation, and it can lead to what? Pagbabara ng mga ugat. It can lead to stroke or heart attack. Okay? So, above all those physical, above those physical consideration, ano yung dapat natin gawin? You need to consult your doctor. You need to consult specifically your endocrinologist. Okay? You need to consult your endocrinologist. Because paano mo malalaman kung meron kang underlying diseases? Paano mo malalaman if you have hormonal imbalance? You need to check yourself by having laboratory and being assessed by a medical profession like endocrinologist. Huwag tayong decision agad. Like me, actually, kaya rin ako nag-decision na mag self-medicate because I have no access and it's hard to find a right endocrinologist in our community. Let's face it. Let's be truth about it because there are some endocrinologists that are not, specialized in gender transitioning. Or in hormonal replacement therapy when it comes to our community. So we need to consider that. Another thing na under ng physical aspect is, do you want to have a child? Siyempre may mga late bloomers tayo. Like me, I am a late bloomer and kwento ko yan sa future. Ako dati gusto ko magkaanak. Okay? And during that time, I'm planning, I do have girlfriend. And we are talking about getting a child or having a child. Hindi ko akalain na darating sa punto ng buhay ko na magta-transition pala ako. And ayaw ko pala magkaanak. Okay? But what if kung talagang decided ka na magkaanak and you are taking hormones. Sinabi ko nga kanina, there are some irreversible or hindi na maiibalik na epekto ng hormones or ng procedure na pinapagawa natin during our transition. For example, if you're going to have a surgical procedure, sexual reassignment surgery, so meaning to say, if you have no gonads or ari ng lalaki, you cannot have a child because you are taking away your gonads, which is your testis, yung itlog natin na naglalaman ng mga sperm cell. And if you are taking in a long-term anti-testosterone, which have an effect on the motility and the quality of your sperm, there are some patients that can be infertile, meaning to say, hindi ka makakabuntis. There are some scenarios na permanent. or irreversible, okay, yung pagka-sterile nila or pagka-infertile nila. So you need to have this decision. First, do you want a child? Because there are effects. Meron naman pag tumigil, na bumabalik sa tamang anatomy or sa tamang function yung mga sperm cells nila. But it will take years, okay? Hindi siya biglang pag tinigil mo sa isang araw, lalabasan ka na ng sperm cell na quality na pwede ka na mag-produce ng iyong offspring. No, it's not easy. So those are the physical consideration that you need. Comment down below kung meron ako mga nakalimutan. I know ang dami pa niyan. And i-share nyo kung ano yung mga kino-consider ninyo. Another thing is social consideration. Okay? Social consideration. Tatlong aspect lang to, don't worry. Social consideration. Ibig sabihin, if you are medically transitioning or even socially transitioning, maaapektuhan ang kilos mo sa community mo at ang pakikitungo ng ibang tao sa'yo. Because harapin na natin na ang iba ay hindi familiar, lalong-lalo na, or hindi educated when it comes to our journey. Okay? Hindi educated sa ating journey. And because we are cultured, ang kultura ng Pilipino, alam naman natin na patriarchal tayo, and also meron tayong tinatawag na machismo. Ang mas lamang pa rin sa pamumuno ay ang mga lalaki. Okay? There are some cultures like that. Even we are building gender equality, hindi pa talaga handa ang Pilipinas when it comes to that. So, are you ready for discrimination? Are you ready because there's still no law, okay, para sa atin? Are you still ready for inequality treatment? Are you still ready for your family? Okay? Do you have support system? Okay? That's the most important. Support system. Okay? Kahit isa lang, kailangan may support system ka. Why? Because it's a long journey. It is a roller coaster ride. Okay? One of the side effects of the hormone replacement therapy or taking hormones is having chemical balance in our brain, and that can lead to depression. So if you have depression, okay, nung hindi ka pa nagtitake ng hormones, it can aggravate or pwedeng lumala yung depression mo or anxiety mo or underlying mental or psychological or psychiatric disease that you have. Okay? Kasi aatakihin ka ng anxiety because of the hormonal imbalance na nangyayari sa katawan. So you need talagang to check with your endocrinologist and even psychiatrist. Okay? So, yun. When it comes to me, sobrang hirap when it comes to social, lalo-lalo na when it comes to family. Kasi lumaki ako sa isang pamilya na pinapatakbo talaga ng mga lalaki, mga macho. Taga dito ako sa Batangas eh. And mahirap sa akin kasi yung community ko, puro kamag-anakan ko, puro barako. Mostly barako, and I am the only one that is coming out as a transgender, and so that's a big decision and a big ball, okay, na kailangan kong i-take para makapag-out. And my journey for the whole 1 year that I am living as a woman, very stiff. Okay? So, ikukwento ko yan sa pagdating sa susunod kong mga videos. Very stiff. At sana, kung kayo man, at least dun man sa aspect na yon, maging okay kayo when it comes to your family, because sana magkaroon kayo ng support when it comes to your family. Kasi ang hirap, mahirap, lalo-lalo na pagkasama niyo yung pamilya niyo. And you're looking up to your family, and you are may ine-expect ang pamilya mo sa'yo. Okay? For me, my support system, ang unang tumanggap sa akin yung aking youngest sister, and I am very, very, lucky to have her. But still, depression sinks in, anxiety sinks in. And finally, may idadagdag pa ako sa mga susunod kong video, what to consider part 2. But this is part 1. Okay? Economic consideration. I am talking about medical transitioning, okay? I am talking about medical transitioning. When it comes, kung siguro wala akong trabaho, or hindi ako nagkaroon ng isang magandang trabaho or opportunity, I will not consider medical transitioning or hormonal replacement therapy. Hindi siya mura. Marami nakaka-relate sa inyo. Hindi mura ang magpa-fresh. Hindi mura ang ang pangalagaan ng sarili mo. Check up, 1,000 pesos per check up for 3 months. And not only that, okay, you need to have your blood work done. And mostly ang nagastos ko, every check-up ko is 5,000 pesos. And that 5,000 pesos, for some of us, is very hefty. Okay? Not only that, a lifetime taking of hormones. Okay? Even naka-SRS ka na or nakapon ka na, or you have your vagina or your female organ, you need to take certain medication and also estrogen level and estrogen hormones. For example, I will give you an example. Kapag sa drugstore nyo binibili yung hormones nyo, Androcur is 72 pesos per tablet. Okay? And you need to take it every day. Not only that, okay, kunwari Androcur user ka, kapag ka naman, spironolactone, we have Hiles, pero makikita mo siya sa Shopee. But if we are taking consideration of pharmaceutical spironolactone, and we have aldactone, sa isang tablet, 52 pesos or 57 pesos per day. So, anti-testosterone lang yan, no? Siyempre, isa lang it's either cyproterone acetate or spironolactone yung iti-take. Hindi pwedeng sabay. Hindi, pipili ka lang ng isang anti-testosterone at isang estrogen. When it comes to estrogen, I have Progenova, na binibili naman sa Mercury. Kailangan meron kang reseta. Okay? Because that's hormone. Okay? Androcur, kailangan ng reseta. So you need to take it from your endocrinologist. Progenova is like 600 to 700 pesos per film. Okay? Isang banig na yon. So, how much is that every day? And also, not only that, collagen, glutathione, kasi nagsimula din ako sa mga ganyan. Every week, nagpapadrip ako 1,600. Oo, kasi hindi talaga ma-achieve. Hindi talaga. Yung pinanggalingan kong hitsura, I will upload a video yung pinanggalingan kong hitsura. Dito sa hitsura ko, kahit sabihin nyo, ay hindi pa siya masyadong feminine. I have my journey, and I know myself that these features of my face and my body was not the feature that I have 3 to 4 years ago. 3 to 4 years ago. Yeah. So, malaking tulong yung mga collagen supplements, glutathione, pampafresh nga. And mayroon ngayon nauuso ng mga supplements to boost your estrogen and makakaano rin. And also the procedures, okay, breast augmentation ranging 120,000 to 165 or more. SRS is like 300 to 1 million pesos. Your nose job, feminization, your Botox. I have maintenance Botox. I'm paying 6,000 pesos per 3 months. Okay? Just to maintain the Botox. Kasi talagang wide na wide yung face ko. And also the HIFU, 16,000 per year. So, you need to consider that. Okay? Kung wala kang budget for that, at sasabihin mong ititigil ko na lang yung pag-hormones ko, ay ititigil ko muna. No, you will not achieve yung yung talagang goal mo if you're going to have it sporadically, meaning to say paliban-libang ka ng pagtitik because you have no budget. And also, because it is a lifetime, okay, lifetime medication and procedures, ayun, beauty have price. Yun na lang isipin natin. So, dun din pumapasok yung aking mantra na I'm paying a lot and at yung aking dati kasi I'm very hypersexual and I settle for less, but now I don't settle for less because I'm taking care of myself. I'm investing on myself